It's gonna be good, it's gonna be great, it's gonna be better, I can't wait. Making my move, live for the day, sing like a bird, fly like a plane. Come spill with me, Jenny D.
Beautiful people, it's me, Jenny D from Spill With Me, Jenny D podcast. Today's podcast episode is brought to you by St. Clair Health, expert care from people who care. I love that line. But today with me, I'm just so excited and delighted for you to take the time, Dr. Mendicino. It's St. Clair Health. I just feel like this is so important, what we're going to be talking about, especially because, safety and the weather being so nice. So anyway, being in outdoor activities after staying inside during the winter, I feel like the winter was forever, is Dr. Robert Mendicino. St. Clair Medical Group, Orthopedic Surgery. Thank you for being here today.
Well, thanks for the invite.
I love it, yes. And we were just laughing off the air. You're just a lot of fun. You're a delight to talk to. So I'm so excited to get into this. So can you start by telling us a little bit about yourself and your background with orthopedic surgery?
Sure. I grew up in Western Pennsylvania.
Oh, okay.
I actually worked at West Penn Hospital for a bunch of years. My parents actually met there. My father was an administrator. My mom worked in the OR, and I jokingly say that I may have been conceived in a stairwell there as a joke, but we worked there for years together, and my whole family was in medicine of one form or the other. I really didn't know anything else. So I went to medical school. I'm actually a doctor of podiatric medicine. I went to Rosalind Franklin University in Chicago and did a surgical residency training out there. And a couple of my attendings there were involved with sports medicine. Took care of the Bears and some of the baseball players. In fact, one of our attendings was part owner in the White Sox.
Oh, wow.
And while I was out there, I got into treating ballerinas because we had a school right across the street from us.
Yes.
And then I got to help treat some of the kids that were dancing with Chicago Ballet. And then when I came back here, really got into training runners and did some research at Pitt, and then also dealt with a bunch of elite runners and professional athletes, D1 athletes.
Wow.
For a decade, I practiced out in Columbus, Ohio. And while I was out there, I owned a couple of high-performance gyms. So we had a bunch of, high school kids,
oh, that's awesome.
D1 athletes,
right.
Pro athletes come in, and we would train them based on their needs. And of course, every sport's a little bit different.
Right.
So the need is a little bit different. So that's what really got me into the sports part of it. And then obviously being a foot and ankle surgeon, a lot of injuries are on the foot and ankle, regardless if it's related to sports or doing outside activities, such as using a lawnmower or weed whacker or a chainsaw. A lot of these injuries occur
even
below the knee.
walking nowadays.
Yep.
I trip so much because my balance is so bad. So that's wonderful. So how did you get here to St. Clair Health?
Well, being from Western Pennsylvania, when I decided we wanted to come back, because both our children have landed here permanently. My daughter is a ballerina for Pittsburgh Ballet, and my son's an attorney. He's in the public defender's office in Westmoreland County.
Oh, wow.
So my wife says, why don't we go back to Pittsburgh?
Yes.
And I plan on finishing out my career here in the next 10, 15 years or so.
You didn't turn into a Browns fan when you were in Ohio.
No.
Steeler fan through and through.
Always.
Always. Well, you were talking about, helping with elite athletes and training. Has that shaped your approach to orthopedic care by having all that experience?
Well, it does when you're dealing with athletes, but when you get into the elite level of training, it's much different in how you manage their injuries and get them back out of the field than, say, somebody that's 50 or 60 years of age, because their healing capacity is a little bit different. So it does help you because you get this state-of-the-art procedures, but also they're just a different little bit of a breed. As an example, when I was doing some of the research at Pitt with a PhD candidate, we would put these elite runners on a treadmill, and their resting heart rate was in the 40s. And they're running a marathon pace at like a 5:30 mile. and their heart rate's at 72, which is probably lower than mine and yours.
Yes.
Resting. So
Right.
it makes it a little bit of a different scenario. So I used to call them lungs with legs,
Yeah, right.
because their ability to keep their heart rate low and keep that pace for 26 miles is unbelievable.
Oh my God, that fascinates me. How is that? How does that happen? Because they've been a runner their whole life.
Their physiology is just what it is. I mean, you can't decide, like I can't decide I want to run a marathon at 2:10. It's virtually impossible. I do some running, but nothing at that level, and they just slowly but surely, it's like cream, they come to the top. It's like pro athletes, you
Right.
only have so many of them.
Right, the wear and tear sometimes on your body, especially in athletics. It's just what is like the main thing that you see with athletes, like the main injury?
Well, it depends. If it's cutting side to side type activities, we'll see a lot of ankle sprains or ligamentous type injuries because they're cutting on a field, like
Ankles,
football, lacrosse, soccer, basketball. Then we start seeing in that 30 to 50-year-old age group Achilles ruptures, same type of injuries too. But typically we'll see those more in a little bit older population. But I'm seeing more Achilles ruptures in younger athletes.
Really?
So, you read in literature, 30 to 50-year-old, that's why you see like Danny Marino and some other people had ruptured their Achilles. But I've seen them as young as 12 because a lot of these kids are overtraining in their sport.
They all year round.
All year round. They don't rest something when they have something that kind of hurts or whatever. They don't rest it and they end up with an injury. So what used to be 30 to 50, I've seen them in 20s and late teens, and as young as 12 I saw one.
Oh my God, your Achilles, it's like right behind your
heel.
Your heel. Okay.
Yeah.
So that must be a bone that gets cracked a little too much, or gets.
Well, not so much cracked, but where the Achilles usually ruptures are right above the heel.
Okay.
And it tears and pulls apart, and then we go in and repair those and get them back together.
And that's probably takes a long time to heal.
It takes usually 2-3 months, but we've changed the way we treat them. When I first got out and I had dark hair, we put patients in cast and not have them walk on them. But now we repair these. We do them percutaneously with little incisions, and we start rehabbing them really early on. By week 1, we have them moving it up and down and get this rehab much quicker than we used to.
Technology has really come full force, compared to what it was back in my day. So what advice do you have for people who want safety to ease back into, like we were saying, running, walking, cycling, or any other springtime activities after this relaxed winter? I don't know if it was that relaxed.
Well, we had a bad winter here in Pittsburgh,
did.
so a lot of people weren't out and about due to the cold and the snow. But, when you go from a sedentary activity to getting active, you got to do it gradually. And most people don't want to do that, especially as they start feeling better. And they increase their pace or their distance, regardless of the activity, whether it's on a bike, which is a lower impact type thing, on walking and running, and they do it too quickly and they start getting discomfort. A lot of times they end up with tendinitises because the tendons aren't used to working that way. So you got to pick a time or a distance and start out. And general rule of thumb is increase 10% a week.
Okay.
And then you should have those type of training periods where you go a little bit hard, medium, and then like I call it a recovery week, especially in running and doing things like that. I mean,
there's, I work out a couple of days a week, and I really incorporated weights recently, and I do yoga, and I also do a spin class. But I find that with my knees, I found out years ago that I have arthritis. So I'm like, well, I guess there's nothing I can do. It's old age, it's arthritis. I can't do any rehab or anything like that. What do you have for that when people complain about arthritis?
Well, that's kind of a general term.
Yeah.
It depends how bad the arthritis is. Is it post-traumatic after an injury, or is it just wear and tear? What joint does it affect?
Right.
So if you have a weight-bearing joint that's the problem, then you want to avoid doing impact activity. So probably for you with knees or someone with a bad ankle, you probably shouldn't be running, but being on a bike is a little bit better. Getting off the seat probably puts more stress on the knee versus staying on the seat.
Oh, yeah.
They got these electric assist bikes now that can get you taken off quicker.
Oh.
Yeah,
I need one of those.
Yeah, they're out there and available. There's different types of bikes you can get like that, so you can cover more distance, so it's not so boring.
Yes. It is.
And then,
It's boring sometimes. The treadmill too sometimes is boring.
yeah, treadmill, to me, I do treadmill in the winter months because I
Right.
just stay on it. I like to try to run, but it's boring as can be.
It is.
And for me, I tried to keep it flat because I started getting some Achilles tendonitis.
Right. You hit
and
those
so-
hills and you're kind of.
And so you're lifting it up and down, and believe it or not, you're probably better off if you start getting over the age of 30, 40, 50, walking at a pace and doing an incline versus running flat, less
Right.
impact on the joints.
It's so true. Walking up and down the steps, sometimes my knees are bothering me really bad. I'm getting that pain from that. And you just don't know if that's a pain oh, this is, you should get this checked because it's a pain that's really hurting you. Or am I just so used to this pain, it's becoming like, okay, I have to deal with it.
Well, some of the wear and tear stuff you feel daily,
Yeah.
but if you have a pain that's bothering you and it continues and gets worse, then sometimes you need to get that checked out or change the activity.
Right.
It's one thing about cross training I think is a really good thing to do. If you get knee pain because you're doing a lot of cycling, like cycling classes,
It's really
squats.
what's hurting now.
And another thing you can look at, and what they've done is change the way people work out. So, for example, using squats as an example,
Right.
you can do squats but decrease your weight. And they do it time under tension. So instead of squatting down with a heavier weight and pushing it up and doing 10 reps, decrease the weight by 50% and do a 5 count down, hold it on the bottom, and come back up.
Right.
So this way it's less damage to the joints. And that's the way a lot of the pro sports teams are going nowadays too. Not so much heavy weight,
Yes.
but lower weight and weight time under tension.
Well, with high school sports, my son's a quarterback, and they're all, oh, who can lift the most, and who, so they're doing, he has like his hammies are so tight from just doing squats and lifting the bars and stuff like that. And sometimes I'm like, you're a quarterback, why are you lifting these really heavy weights? But I think that like in high school, their knowledge with exercise, they know some from their trainers and their coaches and stuff, but sometimes it's kind of like, because I don't know a lot about it, but would you say that someone that's in high school training that it's not all about how much you can lift?
It's not maximum amount of weight. I mean,
Right.
it's a great test, but it shouldn't be daily.
Right.
And you should change up your activity. So it shouldn't be all weight training.
Yes.
There's also speed and agility activities you can do and break up that monotony of that
Right.
type
Yeah,
of
he does
activity.
that too. Yes. Oh my gosh.
And by the way, I mean, most of the high schools nowadays have pretty good athletic trainers
Oh yeah.
and weight instructors that can really get them
They
doing the
watch
right
and make
things.
sure your form's right and everything. Like, yes, we're very fortunate. So what types of warm-ups and stretches or routines do you recommend to prevent these injuries and getting back into regular exercise?
So one of the things I think most people don't do is to get flexibility. So if I take some time off in the winter, the first thing I do for the first few weeks is just stretching exercises. I don't even lift weights. I don't get on the treadmill
Right.
and gain my flexibility back. And I think one of the areas we don't concentrate on, especially as we get older, is our core. The pelvic floor,
Yeah.
ab, back. And so I think working on those things for flexibility is really good. And gaining strength with those things. I use an example and even wrote it down. There's a sit to stand test. And you can look it up online. There's a
Sit
bunch
to
of
stand.
sit
Okay.
to stand. Under the age of 30, usually like a 20 to 24-year-old, would they sit in the chair, cross their hands like this, and
get
stand
right
up
Yes.
and sit back down. 20-year-olds should be able to do about 50 of those as a
Yeah.
guy, and I think as a female around 47. I think that's the average. And then when you clump everybody together, it's not athletic as well as athletic.
Right.
That's like 33. But as we go up in age, that number drops down significantly because as we get older, we don't exercise as much.
Right.
So you start looking at the age of 60, the average is 14 for a guy, and for females it's 12. And then we get to 80, they should be able to do 10 without assist. Now, granted, if you have knee arthritis or problems in joints in the lower extremity, but when we start seeing that dropping off significantly, then we know that the muscle mass is decreasing. It's just a simple test.
Yeah.
So I checked myself the other day, and I kept up with the 20-year-old.
Yes.
As old as I am, I'm like, I can do that. Next day, my legs were killing me. But I mean, those type of things
Right.
are simple tests. And, and another thing I look at is if you're doing activities such as running or cycling, we get the flexors and extensors of the lower extremity working quite well. But if you're 70 years old and sitting at home and watching TV all day long, as you sit, our glutes get weaker, and then these muscles get tighter or contracted. And that's why we see the older population falling, having head injuries, because they're not strengthening the back tightness here. And you see the older patient population, what we call head forwardness, where the head's like this, and as they walk,
oh my gosh,
their body weight gets out in front of them. So if they trip, they end up hitting their head and have injuries like that. So that's a simple test. And when my mother was getting older, and I said, I know you like watching Chicago Fire or whatever the TV show is, and you watch it all day long. But after every show, stop so you don't just keep running these on and sit there for hours, and do what I call stand-ups. Do 10 of those every hour, walk to the kitchen and back. And then I also talk about posture. So I'd have my mother stand up.
Oh, I feel like my posture right now.
Till her buttocks hit the wall, and then get straight up, put your chin down and get your head against the wall. Because if you're sitting all day long, you're like this. What we want to do is work on posture. So the older we get, we start leaning forward.
I feel like my shoulders go forward.
We all do.
Yes.
I call it the crunch walk. You're like this. And you can see the older population. And for me, because we see patients at all ages, the older patients, for me, I'm concerned about muscle strength and exercise. And just getting up and moving is a good thing. Body in motion stays in motion.
Right. The place where I do my weights, there are a lot of people that are much older than me, and they are doing like heavier weight than me, and they're doing great. And I look at them, I think, what, this is great that they're taking care of their health and their strength, because like you said, our bone density, right, is so. But you
have to keep moving. Yeah. That's the big thing. If you stay sedentary, it's not good. And then looking at exercise, you look at running and walking. There are statistical papers written that if you get 10,000 steps in a day, your life expectancy goes up wider and decreases cardiac risk. Yeah. So you don't necessarily have to run, but if you get up and walk daily, and if you want to run, you don't have to run in an hour. If you run for 10 minutes and then jog for 10 minutes, that's good. If you do that 3 days a week, that's really good for someone that's not active. And then if you're 70 and you haven't run in your lifetime, probably shouldn't start running, but getting out and walking is really good. Even walking on a treadmill, however you can do it, movement is good.
I was thinking too, like stairs. My dad, he walks at South Park, and then he'll go sometimes to a stadium and he'll walk up and down the stairs. It takes him a little longer, he's more tired, but I think that's a great exercise too. Do you think?
So any type of steps is good, as long as you have a rail. If you're older to come down, so you don't want to fall down the steps.
That is so true. So I think we were already talking about this. The best ways to support long-term joint health and mobility. Especially as we age. I think you were talking just about that just now. But do you have anything else you want to say for that?
Well, another thing is weight.
Yeah.
Keep your weight off.
Yeah.
I mean, as we get older, you put weight on. As you sit, you put weight on. And for me, I was about 40 pounds heavier than I am right now 10 years ago. And I got the weight off by working out, doing it very gradually, and getting back in shape. But then I took that same amount of weight, essentially took a 45-pound weight and carried it and walked down a track, and I'm like, I can't believe I was carrying that.
Oh my gosh, that's so true.
And for me, I can tell you what my weight is when I'm running. So if I'm above X weight, I have a little bit of knee discomfort. If I'm above a weight a little bit higher. So I know where my sweet spot is to be able to go out and run and be active.
Right. Your body. You have to listen to your body, right? Like if you're feeling these injuries, or you're like, oh, I'll just work through it. If you're like limping and you're trying to run, you say no. Listen to your body and stretch.
And sometimes if you have a joint that hurts, it's got some arthritis in it, and you do it either through diet or a combination of exercise, and you get the weight off, sometimes that joint pain goes away.
that would be so nice.
And even for me, I had Lyme's disease during COVID.
Oh my gosh, I'm so sorry.
Well, no, it's curable. You take an antibiotic.
Thank
but
God, yeah.
when I got it, it was during COVID.
Oh.
Talking to an infectious disease doctor during COVID was
Yeah.
almost impossible.
Right.
But I got the blood test done and it was positive. I
Wow.
took the antibiotic. Within 12 hours, I felt normal, but it did a little bit of damage. That's why I keep my weight off, because my left hip has a little bit, and my right knee, because it does attack the joint surfaces. But by keeping the weight off, I can still do those activities. But once I start getting that weight up a little bit during the winter months and I start getting active, it starts aching a little bit.
Yeah.
So my sweet spot for me, I'm about 5'9", is right around 160.
Okay.
When I get above 165, my knee hurts a little bit. Above that, sometimes my Achilles and my left hip. So I know that sweet spot.
You know your body.
So if I'm out running and my knee hurts, I go, I got to be over 165.
Yeah, I know, right? I must have gained weight over the weekend.
Yep. Christmas holiday's terrible for Italians.
Easter too, with all the chocolate.
Yep.
I mean, I can't say no to my Sarah's eggs. My coconut ones are my favorite. But yeah, it's so true. If you think about your weight, and they used to say like, muscle weighs more than fat.
It does. It's more dense.
It's more dense.
Yeah, so it's like 3 times the weight because it's dense and it's strong.
Okay.
So sometimes people,
I need that.
when they're trying to lose weight, they start gaining weight because they're working out, because they're building muscle.
Right.
Like, when I'm putting weight on, I don't want this to happen, but over time you'll lose the body fat. And so you may increase, but then you'll start losing the body fat after.
Check your inches and things like that. I remember I was working out with a trainer. I was like, my weight's not changing. But he's like, Jen, let me check your inches and see. And he goes, yeah, you're doing great. I'm like, oh, okay. Sometimes that scale's like, ugh. So what are the common injuries that you see this time of year when people are getting back to the outdoor with the warmer weather? I know we were talking about the ankles and the Achilles. Do you see anything with the ACL or anything like that?
Well, generally, unless it's an injury from a cutting or they have a previous injury, not so much. And that's more my partners, because that's outside of my scope of what I do. But foot and ankle is very common. And the big thing is people need to get appropriate shoes.
Oh, I never thought about that.
I see people buying shoes or they come in and this is what they're walking in. Getting a good fit is appropriate. And we did a simple test, I don't know, about 10 or 15 years ago, and we had patients coming into the office and they measured the shoe size in everybody. Generally speaking, women wore about a size to 2 sizes too small. Guys were pretty close to being right.
Why would we do that to ourselves?
Because maybe you don't want to say you wear a size 10 or whatever. I don't know.
Oh, who cares, right?
But then also looking at the fit of the shoe, because if the shoe's too short, then you're taking the wider part of your foot and putting the narrow part of the shoe. So you want it wide enough.
Stepsisters.
So you want to make sure it fits right. And most, at least half decent athletic shoes aren't cheap. But if you don't get the appropriate shoe, what you would have paid for the shoe, you're paying for co-pays to physical therapy or to the doctor's office. So that's the first thing you start with, getting stretching and flexibility and not going crazy. So you don't go out after being off for 3 months and walk 5 miles. And the older you get, it's a little bit harder. Oh, yeah. And I use my son.
I walk the dogs.
My son ran cross country in high school and was one of the team captains.
Oh, wow.
So teenage, right?
Yeah.
And so a couple years ago, now he's 30. A couple years ago, he decides to go out for a 4-mile run. And I go, I probably wouldn't do that. I'd probably start out with a couple miles, or you can recover quicker than I can. He goes, nah, I went for a 4-mile run. The next day he goes out for a 4-mile run. I go, you're going to end up with shin splints. And I see him 2 days later packing his legs in ice because he overdid it. So the muscles and the bones.
Do you think he'd listen?
No. Well,
they don't listen to us.
No, they don't listen to any of us. And it doesn't matter if you're a doctor or not. They don't listen most of the time. But and he had to go backwards from there and start again. And he got back out running appropriately. So doing gradual increases of activities, because this time of year we see a lot of stress fractures. And I compare a stress fracture in a bone in the foot to a coat hanger. You take a metal coat hanger and you bend it, right? It's really stiff at first.
Yeah.
And as you bend it more from overuse, you get more cracks in the metal. And if you keep bending it, eventually it goes and snaps.
Oh my gosh, yeah.
So it's this micro fracturing of the bone, but not a through and through fracture. But if you keep doing that,
right.
and you don't pay attention to pain and swelling and discomfort, eventually it can crack all the way, or you're off again for another several weeks until you recover to start again.
And that's the worst, especially, you know, with these elite athletes, you know, that you worked with. I mean, they probably were like, come on, I want to get back in the game and do this.
Well, the runners are the worst. You go, hey, doc, whatever you say, as long as they can run 100 miles this week. And I go, well, you have a stress fracture in your tibia.
Yeah.
That's okay, whatever. Whatever I need to do, as long as I can run 100 miles. But I would take them and put them in a swimming pool with a buoyancy vest, because with a stress fracture, like I'm describing,
Yes.
can't run on it, but they can get on a stationary bike with no resistance. They can get in a swimming pool and run in place until they recover and get that thing to heal up.
Oh, I love that. I know being in the pool is always like something that kind of helps your joints and everything. Are there particular warning signs that people should look out for, like that may signal the overuse injury or something more serious? Like, is there signs?
Well, pain usually is one.
Well, right, number one.
So if something starts hurting after the
Red
exercise, take a couple of days off. Go out and do it again. If it's still hurting, then you may need to cut back on that activity. Or if it's weight training, decreasing your weight.
Mm-hmm.
But usually pain, swelling that doesn't recover and continues, you wake up the next day, it's even worse. You know, there's telltale signs that we get that we don't respond to. So if you start seeing pain, swelling, redness, black and blueness, and it doesn't recover fairly quickly, then that's when you want to get things like that checked out.
So true. I know it for me, my neck, it's always my neck. Like I'm always like, oh my, did I do something to my neck when I was lifting? Or, you know, I think that we strength, you know, our shoulders are always up, and I feel like we're holding everything with our shoulders and our neck.
And if you're doing a lot of work on the computer, you're like this all day long too. And so that has a tendency to affect it. So we don't really work out our back muscles.
Yes.
So a lot of people will do core sit-up type things, but you also got to work your back. So
that is so true.
So like for instance, I call it Superman. You lay on the ground and lift your hands and feet off the ground. It starts working the lower back, upper back. The other thing we don't work on, especially if you're doing a lot of running, is we don't work on our side to side, the abductors and the adductors in our hip. So doing lateral planks, laying on your side. And then once you get that done, then you can start working even more the core by lifting the upper leg up. And then sometimes as I get stronger, you can put bands between your legs and even strengthen it. But you'll find that people do a lot of running, and I watch runners as they're going by, and as they get on the one leg and you see that hip drop down on the dependent side, that means their abductors are weak. And over time that can affect like the hip joint and other joints too, because it starts putting stress on the knee and the hip. So we discuss with them working those type of muscles. And when we owned the gyms in Columbus, even the elite people, we would take them through a series of exercises, find their weakness and work the weakness. Whatever their strengths are, they'll get that a little bit better, but you'll always find a weakness in somebody.
It's true.
Like one of my partners in Columbus was a ex-jock. Mm-hmm. And we found out his abductors and his hips were really weak. He couldn't do a lateral on the side plank.
Oh my God.
And so we worked on that, and over time it improved for him for that strength.
See, yeah, I mean, I didn't even think about that, but with yoga, we do some stretching like that. And I do feel like so much better when I'm doing those. You know, I didn't think I could do those side planks anymore. You know, you just feel like your body isn't equipped. And then now I'm like doing so well with it. It's just like you got to keep going at it. Right?
Yeah, because you can't just keep everything moving this way. You also got to have it this way.
Right.
Because those are stabilizers of the lower legs.
Yeah, the hips, a lot of people talk about the hips. You need to like really stretch and do activities, to help with that. But how can patients stay active even while recovering from an injury? I think we were talking, like, are there modifications or alternatives you recommend for the support long-term joint health and mobility?
Well, if you've had an injury, like say, for instance, someone broke their ankle, and we had to put plates and screws in there, and we can't let them walk on it depending on the type of injury, we can still do core workout. We can still do upper body stuff. And then we have a tendency to get these patients, moving a little bit more quickly.
Yeah.
But with those type of things, it takes several weeks. I always say 6, 8 weeks, double that time before you're back being active, usually
Yes.
double that time before you're back to doing what you want to do. And the biggest cause of an injury after an injury is getting back to that activity too quickly.
Yes.
So whatever, tendon injury,
Yeah.
Achilles rupture, and you decide you want to get
your
back.
body, right?
Well, it's not just body, you just got to figure it out. Like, I got to get my time frame set up. And as an example, if someone ruptures their Achilles, I have a 4-month plan for them.
Oh,
so
really? Okay.
week 1, they come in. As long as the incision site looks fine, they start moving their foot up and down. Week 2, we start doing more reps of that. Week 3, partial weight bearing. Week 4, full weight bearing. And then we have a whole list of things they continue on. And depending on where they are in that rehab,
Right.
so if the incision took a little bit longer to heal, then I move that to week 3 instead of week 1. So we modify, but we want to get people back moving. But some things just take longer.
I know.
But you can still work on the upper body.
Right.
You can still work on
That's
core.
the hard part is, people want to know when, like, and you're giving them a general, like maybe 6 to 8 weeks, or you don't know how well they're going to, because when they go home, you don't know what they're doing. So they got to make sure they're listening to you and doing everything at home as well.
And then dietary, I'm really into food substances and looking at what we eat. What we eat now is much different than what we were eating 20 and 30 years ago.
Yes.
We have a lot of farm-raised fish, as an example. Salmon, big in vitamin D.
Right.
But there's a difference between farm-raised and wild caught. Wild caught has about 75% more vitamin D than farm raised, and the reason being is they're raised in big nets out in the ocean, and the other fish are swimming wild and picking up sunlight. We look at things like milk. Most dairy cows were outside. Now they pretty much live inside.
Yes.
So just looking at vitamin D as an example, when we look at that, there's a lot of people that are vitamin D insufficient or deficient, which affects bone health and bone healing.
Does it really?
Yeah.
So everybody should take like a vitamin D supplement or eat something.
That varies from person to person. If you don't know what your vitamin D is, you may be low. And looking here, what I call that northern corridor, we looked at something when I was in Columbus a few years ago. In our practice, 7,300 of the patients had their vitamin D checked. 5,800 of them were vitamin D insufficient or deficient. And another thing that's happening is we go out in the sun, but we sunscreen, so we block it.
Oh, that's true. We do. But we don't want to get melanoma. So it's like,
and then the darker complexion, the more sunlight you need to absorb all that, because the melanin blocks that.
Oh.
So that's a big thing for bone healing. If a patient right now trying to heal a fracture and we check the vitamin D and it's 18 or 15 or down to single digits, when it should be somewhere between 30 and 100, well, that abnormality, we have to supplement. I'm vitamin D insufficient. I take vitamin D every day.
I do.
But I checked mine and I knew what it was. And after I took high doses of it, about 3 or 4 months later, it started dropping back down.
Okay.
So now I know where to supplement to keep mine in between that 30 to 100 range.
Yes, I just recently got blood work, actually at St. Clair, and she said, it's not, my vitamin D is not low enough to take something that's stronger, but I just take something over the counter, and I do feel a little bit different. It's like it's been helping. That's the thing with your cholesterol. You got to get checked, and make sure your body's all in check, aligned with all your joints and everything like that. But so, what's one thing you wish more people understood about orthopedic care in preventing injuries?
Well, when people think about musculoskeletal surgeons, orthopedics, subspecialists of that, whether it's upper extremity, lower extremity, sports medicine, is they think of orthopedic surgery, musculoskeletal surgeons, they think of surgery. Our goal is to try to prevent surgery.
Yes.
So if something's bothering you, you're better off getting it checked and us telling you it's okay, or modify your activity, than let something go and then it becomes a problem that requires surgical intervention. So our goal is, you have something that's not necessarily healing or it's hurting, come in and get checked out. We can modify your activity or give you recommendations, Or if something needs to be taken care of it earlier than letting it become worse
Right.
and ends up in a bigger surgery, a longer recovery, and not necessarily as good of an outcome as we like to see.
Right.
And again, 10, 20, 30-year-olds are much different than 30, 40, 50, and above ages. And I think we aged a little bit more during those COVID years. So we used to say the 60 is the new 40, but during COVID, that's kind of flipped for us because a lot of people sat around not doing very much. And so coming out of COVID, now we're a couple years out of it, but some of those older patients really aged and decompensated. So they got to get back to getting into some exercise, and just getting up and moving is a key. Checking your balance, simple test, stand on one leg. See how long you can do it with your eyes open.
I don't know if I can do it.
And there you can look this stuff up online. One leg test, sit to stand test, find out where you are. And if you're not within the norm of that, then you got to start trying to do something. And the hardest thing is to get someone from sedentary to movement.
Yeah.
Procrastination prevents you. So if you can just do that and just say, instead of 5 days a week at first, go to Monday, Wednesday, Friday.
Right.
Then end on Monday, Tuesday, Wednesday, Friday. Or, maybe on the weekends, cheat on your diet, but stay on a half-decent diet Monday through Friday.
Right.
I have a cheat day. It's one day on the weekend.
I do too.
Then after that, I try not to cheat for the rest of the week.
Like Saturday will be my cheat day because we're celebrating Easter on that Saturday. But if someone is dealing with lingering pain or movement issues, when should they consider seeing an orthopedic specialist?
Well, some of us have day-to-day discomfort, but when it starts affecting your day-to-day activity, where you decide, well, I would like to go to Kennywood as an example, or Park here in Pittsburgh, but I'm not going to be able to walk through there all day long. I think it's time to get something checked out. And it can be multifaceted. It can be a combination of age. It can be pre-existing conditions. It can be weight. It can be a variety of different reasons.
Right.
But if you start thinking about doing things and it's going to prevent you from doing it, I think it's time to get something checked.
Right.
And that's the same thing seeing a primary care physician. When you're 10 and 12, people don't look at it so much, but you get over the age of 50, I think a regular annual examination, getting that checked out, and looking at the musculoskeletal, bone and joints and tendons. If it's changing your lifestyle, I think it's time to get it looked at.
Oh, definitely. Would somebody have to get like a referral, or could they just call, St. Clair and be like, hey, I need to see an orthopedic?
You can call into our office,
Oh,
and
really?
so it's not a referral. That was a big thing in the 80s and 90s. You needed a gatekeeper for the referral.
Yes.
Now you can call your primary care physician up and ask for an opinion of someone, but in our practice, we have open hours, walk-in times for patients to be seen.
That's awesome.
So we're here to accommodate the people's needs and times.
Oh, that's great, because a lot of people are not intimidated, but they're like, well, I don't want to. If it's not really that bad, I don't want to waste their time and go see an orthopedic surgeon. I think that that's kind of gives people like, oh, I don't want to bother them, but
you're not wasting our time.
Right.
We're here to help. So if you're having a problem and you're making an appointment, you need to be seen, or at least give you a comfort level that you're not hurting yourself. So to us, every day of the week, you can get in to see us. We have open time walk-in hours, and everyone in our group is very accommodating. That's one of the reasons why I joined this group. They're very nice.
Yes. Talking to you today, I'm like, oh my gosh, maybe I need to come see you. So thank you again,
Sure.
for being here. Is there anything else you wanted to say that we didn't cover?
Yeah, I think we covered it. And obviously, if anyone has questions, feel free to call into our office. We'll gladly see you. Often we'll just answer telephone calls with messages through our staff.
That's awesome. So if you're in need of expert care for a bone, joint, or muscle condition, Dr. Mendicino, I don't know why I have to say it like that, and his physician colleagues at St. Clair Medical Group Orthopedic Surgery can provide head-to-toe orthopedic services for patients of all ages, which is so great. They're currently accepting new patients at their office. Their locations in Peters Township and Mount Lebanon. For most conditions, same-day appointments are available by calling 412-942-7262 or 412-942-DOCS, DOCS. Yes, so thank you so much for being here. Oh
Thank
my
you.
God, such a pleasure. I learned so much from you, and thank you so much, St. Clair Health, for sponsoring this episode and partnering with me to make healthcare an important issue to talk about. Thank you so much.
Come spill with me. Come spill with me. Come spill with me.